this afternoon. We are not posting senior high school graduate to act as nurses or doctors. That's the response from the Youth Employment Agency after it received backlash over its ongoing enrollment of high school students for deployment to rural health centers across the country. The job description of the recruit is to SHS leavers to help nurses with recording medical history and symptoms, conducting physical examinations, and providing simple bedside care to patients, mostly in rural communities. However, the Registered Nurses and Midwives Association is describing the move as worrying and potent danger to public health. David Tinkrai Chum is General Secretary of the group.
To the health of Mother Ghana and everybody in here. So we acknowledge the work of doctors, we acknowledge the work of nurses, we acknowledge the work of midwives and so on and so forth. However, I'm not sure everybody can do every kind of job in whichever field they are. And we have a basis for what we are doing, which is greatly supported by the World Health Organization, it's supported by the African Union, and it's supported by the Parliament of Ghana, the Ministry of Health. In fact, we are doing this under the auspices of the Ghana Health Service. It'd be very surprising to believe or think that the Ghana Health Service, the Health Subcommittee of the Parliament of Ghana, and the Ministry of Health have not gone through all of these things that we are talking about and have not really thought about it. What we are doing is, first of all, to create employment for the young people, young men and women of Ghana. Secondly, to attend to primary health care delivery in preventable health care, and especially in the rural communities. We are not posting anybody to any big hospital like the Bank Hospital here in Accra. We are not posting anybody to, for example, the Tamale Regional Hospital or the Northern Regional Hospital in Tamale. We are posting them to the Chief's compound. We are posting them not to act as nurses. We have been very explicit on this. Not to act as nurses, not to act as doctors, but to act as preventive health service officers. My brother, you would agree with me that we are in the rainy season, for example. Cholera usually comes out as an outbreak every rainy season here in Ghana. What do we do that we get cholera as an outbreak every rainy season here in Ghana? It is because of little practices that we have in our homes.
Yeah, but if you may, I mean, if you look at the concerns from the group, they're saying the CHIPS compound actually formed the basic unit of our healthcare system. You don't want to dwell with that, particularly knowing how difficult it is for some in the rural communities to access some of the district facilities.
Where did we write that community health service providers are going to man the CHIP compounds? We haven't said that anywhere. We are not saying that they are going to be administrators of CHIP compounds. We have not said that they are going to administer injections to anybody. We have not said that they are even going to take temperatures of anybody. They are going to assist the professionals.
But there are a raft of measures, or I mean, some of the services they'll be able to provide, and that, for instance.
So if I may, you have a list of that. Yes, explain it.
Right.
If I may, and he understands that none of our recruited people are going to provide these services that are provided by professional health service providers, and that is what we are talking about. That, for example, pick a folder for me. If I'm a nurse and I'm attending to a patient, pick a folder for me. What kind of expertise do you need to pick a folder for someone? Attend to or educate people in their houses on the fact that you don't need to defecate anyhow so that we can prevent cholera outbreak. What kind of expertise do you need to be able to do that? These are young men and women we are taking out of these communities, very remote areas where you post midwives and they don't want to go, where you post doctors and they don't want to go. That we should be able to prevent, for example, outbreaks. When Corona came out, we needed people to go into houses to educate people on how to wash their hands, how to bath, how to do things when they come back from town. It's the public and these people that you will get into place. These are people with aspirations to become nurses. And they call them SHS leavers. We don't call them SHS leavers. They are graduates of SHS. Some of them don't have the requisite certification yet. Others have the requisite certification.
So that's Akwesi Afriye who speaks for the YEA. We cannot listen to the General Secretary of the Nurses and Midwives Association, Chum.
We saw a publication on Joy Online to that effect, and we have gone on this route before, so we are not surprised at all. to see this thing being resurrected. So that was the reason. That is how it came to our attention. The YEA should halt that program. They can train people for various reasons. We have no qualms with that. But once they have specified that they are going to train people for that number of weeks to be sent to assist nurses, is where we have the problem. Because we have already trained nurses and midwives in the system, close to about 20,000 people who are ready for employment. 10,727 of them actually access the recruitment portal of the Ministry of Health for the past 9 months. And all what was left was to distribute them to the various agencies under the ministry for them to start work. That did not happen, or it has not happened up to this time. So what is the essence of going to use the taxpayers' money to train people again? And we read in their bullets that they will discharge themselves in a manner, in a way that they could assist nurses by taking medical history. It appears as if they don't understand what constitutes medical history. Now, if you want to take medical history, it's not like, what is your father's name? Where does your father come from? You need specialized skill to be able to do that.